Mahafide from Saipan in the Northern Mariana Islands. Thanks for joining us on our fourth episode of Pacific Matters. My name is Tomas Manglona, and we are reporting to you from the government-mandated quarantine facility at one of the hotels on the island. Today's show is focused on the front line here on Saipan and on Guam. And first, as we've reported, all incoming travelers, unvaccinated and vaccinated, have to undergo this quarantine process on Saipan. First, here's a look at what it's like and how things have changed since we first covered this story.
This is why we're out here. We take the precautionary measures to make sure that we're safe for all of you.
Last June, we went behind the front line at the Saipan International Airport and the Pacific Islands Club Hotel. We got a closer look at the quarantine process for incoming travelers. This morning, we're on the other side of the process, in quarantine. Before boarding the plane on Guam, passengers are required to fill out a mandatory declaration form that asks about your health, travel history, and if you're vaccinated against COVID-19. Once we touched down, we were escorted to hallways where frontline workers verified our point of origin and vaccination status. Then we went on for our first COVID-19 tests at the airport. When passengers arrive, vans shuttle them to one of the two government quarantine facilities, Kanoa Resort or the Pacific Islands Club Hotel. We were assigned to PIC. They provide internet, 3 meals a day, and allow delivery of food and other items that are carefully handled by the staff. We aren't allowed to leave the room. The mandatory quarantine for all incoming travelers has been praised by many and receives wide support in the effort to contain COVID-19 outbreaks on the island. Travelers get tested on day 5, and if you're negative, you're released from quarantine. And when we come back, we share more from our 7-part Behind the Frontline series. Welcome back. 2 weeks ago, the KUM News team went behind the scenes at the Guam Memorial Hospital. We saw the dedication, courage, and also the exhaustion. Our 7-part series highlighted what some call ground hero. In our first segment, we hear what it's like working through this pandemic. It was once known as a COVID hospital. Almost 2 years later, healthcare workers are still holding the line.
We continue to serve this island. We are exhausted. We do everything we can. We stretch every way we can. COVID has taught us that we have absolutely no limits. So we keep pushing for everybody in this community.
KUAM News goes behind the scenes at the Guam Memorial Hospital, where those limits continue to be tested. 9 weeks into the island's third surge, with triple-digit positives daily and more patients dead on arrival.
We've opened about 7 COVID care units throughout GMH or GMH facilities. We have opened new areas or transformed new areas, and this is a unit where we've mixed COVID and non-COVID patients. It used to be, when we weren't in a surge, it used to be just a cardiac unit.
You can feel the exhaustion, but also the courage and commitment to save lives.
We're taking care of some of the sickest patients on the island, and we just have to push through.
Sometimes pushing through a breaking point.
Staff here are really tired and burned out. Some are a little unhappy. It's sad to say, but this is where they're at. They're really tired. They're really burned out. They've exhausted a lot of themselves on the second wave, and then we recovered from the second wave, but getting hit again on third wave with far less help than the second wave, it really has took a toll on a lot of the nurses.
These nurses have been here from the start.
Some of our hardest days is we're doing everything that we can to help these patients, and when you're not seeing them get any better, despite all the treatment you're providing, all the proning, all the education, that it's just sad. And unfortunately with this third wave, we're seeing a lot of patients that they don't want help. They want to leave. They want to go home. And we're telling them, you're really sick. This is the only place where you can get your treatment. And even despite all the efforts you do, some of them they want to go home.
In our second segment, we learn more about the practice of proning, something healthcare workers encourage all COVID-19 patients to do.
Proning has been shown in non-COVID patients to be very beneficial. I even tell this to my families and friends who test positive in the community to lay on your bellies.
It's all hands on deck for healthcare workers at the Guam Memorial Hospital.
Proning is literally laying on your belly. And that allows the lungs to open up.
And they use every practice in the book.
We use all of our staff. We maximize every movement in that room. It is everybody's responsibility to go in and assist the patients.
She says the data shows proning and medication decreases the ICU level of care and intubations. Nurses focus on letting patients understand the importance of proning.
The moment they're diagnosed with COVID, they're immediately told to start proning because it does help with getting air into your lungs and helping to open up the lungs a whole lot.
Patients can breathe easier, and perhaps frontliners too.
It's a whole multidisciplinary team working to get these patients better and out of the hospital.
In part 3 of our series, healthcare workers tell us the lengths they go to keep patients alive. Here's more.
The mortality rate is 80%. So I can't say that more patients are coming off the ventilator. I can say that unvaccinated patients are being ventilated.
COVID-19 still surging on island, and Dr. Jolene Uggan says mortality increases when patients are ventilated.
And we are doing our best to get them off the ventilator. We do extubate patients. As you can see, we've had a few patients that have been in the hospital with quite a prolonged stay that were pre, the vaccination era.
Even in this post-vaccine era, healthcare workers are pushed to the limits.
Definitely been a lot busier than it's ever been for the last few months, and even if you compare the last surge to this surge, we've been seeing more patients in all populations.
That includes children, the elderly, and infants.
Just overall, the census has been much higher, and it's been busier, and it's been like 24/7.
We asked Dr. Jolene Uggan about hospitalizations for the vaccinated and unvaccinated.
Did you want to just kind of get into that and
I
address
don't.
it? No?
I don't. I just can tell you the course that we actually see.
What do you see?
With unvaccinated patients, just having a more prolonged course, and of course higher mortality if they are in the ICU, which majority of our patients that are unvaccinated can progress to get intubated and then hopefully extubated, but like I said, up to 80% mortality.
Again, we want to thank the healthcare workers at GMH for their time and service. We'll have more after this break. Welcome back. In part 4 of our series, we learn more about the incident command system and the frontliners in charge of planning in times of emergencies. Jeffrey Ventura is second in line in the incident command system at the Guam Memorial Hospital.
In any emergency, whether typhoon, pandemic, like now, when the hospital is an emergency, we stand up what they call the Hospital Incident Command System or structure, with the incident commander being first Ms. Lillian.
They've been at the front line since March of last year.
So knowing what we know now, we are more prepared, more experienced, and on what to request, knowing what the government agency's limitations are, because the Guam pandemic plan will only work if it's realistic. However, we're finding shortfalls, so therefore we cover the shortfalls and we move on.
Moving on still means holding the line, especially when healthcare workers are busier than ever.
So we want to kind of batch our interventions together, so when you go in the room, you do a lot of things at one time. So you want to avoid unnecessary people coming in and out as much as possible, just to lessen the risk.
Healthcare workers constantly assessing the risk.
So this is what the nurse's station looks like. If you can see to the right over there, all patients are on a cardiac monitor. First to your right, we're watching their cardiac rhythms.
frontliners keeping watch and holding the line. In this next segment, a doctor tells us the most common questions he gets from COVID-19 patients.
I think, in terms of the burnout, in terms of the staffing, I know that it's been a challenge, particularly on the nurses' side.
In his 5th year serving at the Guam Memorial Hospital, Dr. C has seen the great lengths frontliners go to.
Unfortunately, the COVID patients require more time and more resources.
Dr. Jolene Uggan says they'll continue to hold the line.
GMH has done everything that it has been able to do since the onset in March 2020.
And Dr. C treated one of the very first COVID-19 patients on Guam, recalling the panic and anxiety. Today, he says there are 2 questions unvaccinated patients ask him the most.
The first question is I'm going to be asked is, when can I get the vaccine? And the answer is unfortunately not today. The second question is, when can I eat? And I wish I wouldn't have to hear this question. I wish, everybody would be vaccinated, and I wish, the third wave could be smaller than it is.
Those wishes turning into hope, even amid some frustration.
I was frustrated, and you asked me, why were you frustrated? You look like a nice person. I was frustrated because, if we all would be vaccinated, this third wave most likely wouldn't happen as much as it happened. And that's why I was frustrated. The medical part, the burnout, that's manageable, that's a part of the job. But, if you have something that you can prevent it and you didn't, that's where the frustration.
In our last 2 segments, we share more of our conversation with healthcare workers who've seen the pandemic from a different perspective at the front line, day in and day out. Here's more.
I've started working on the floor again. Last time I worked on the floor as a charge nurse was about a year ago during the 2nd wave, and now I was called back to do charge nursing here in the 3rd wave, and yes, it's a whole different perspective.
And the nurses at the Guam Memorial Hospital continue to adapt.
I'm a case manager. What we do is we plan for discharges for patients. So far, all of our case managers, those that are helping with discharge planning, are pulled out to do different things while we're dealing with this wave.
With some federal help already on island, they're hoping to breathe easier.
Day to day, we have to wear our PPEs pretty much our whole shift. We're putting our PPEs on and off throughout our shifts if our patients call. We're also working along hand with case management, rehab, dietary, respiratory therapy.
The multidisciplinary team continues to hold the front line.
Right now, all the hospitals in Guam take care of the COVID patients. So, during the 2nd wave, we were kind of on our own. The 1st wave, the GMH was on our own. I think it's a daily bread right now.
And they continue to serve the community on a daily basis.
I wish, the COVID would be over. I wish it would be the end of COVID. I wish that 3rd wave didn't happen.
We've heard the persistence.
We have served this island. We continue to serve this island. We are exhausted. We do everything we can. We stretch every way we can. COVID has taught us that we have absolutely no limits. So we keep pushing for everybody in this community.
And we've heard the hopes and frustrations of our island's healthcare workers pushed to the limits in this pandemic.
If we knew things we know now, during the 1st or 2nd wave, yes, it would be much easier, and I think the burnout would be also much less. I was frustrated because, if we all would be vaccinated, this 3rd wave most likely wouldn't happen as much as it happened. And that's why I was frustrated. The medical part, the burnout, that's manageable, that's a part of the job.
Even with the exhaustion, staff at the Guam Memorial Hospital remain at the front line.
It's been busier and it's been 24/7. So we're really blessed to have staff that can keep up with the traffic and keep up with the care to serve our community.
And keeping up also meant learning quickly and adapting to what's become known in the COVID-19 era as a rapidly evolving situation.
The Guam pandemic plan will only work if it's realistic. However, we're finding shortfalls, so therefore we cover the shortfalls and we move on.
And here's more of our extended interview at the Guam Memorial Hospital. We're trying to take a behind-the-scenes look on the front lines, just to give people a better look at what's happening here. What's the status update you have for folks in the community?
The status, we are, if you look at our census, of 27, I believe, that was our COVID census this morning. It's a census that rotates. So, if today is 27 and then you see 27 tomorrow, that could be the same 27 patients or a turnaround of at least 6 to 8 patients. As far as the ICU level of care, we're in 3 different locations right now because of our severe ICU nursing shortage. We've had to have some of our non-ICU nurses help us to take care of our ICU level of care. So we're very happy that the DoD nursing staff has arrived at Guam Memorial. This will not only allow us to maintain our 14-bed capacity in the main ICU, but it'll also allow some of our nurses who have not been able to take off and take a break to have that R&R for a short time. We do have traveler nurses that will be trickling in as well over the next couple of weeks. So we're really excited about that. We're happy that the Gung medics are here to help us in both the ER and the ICU. We also have the Guam Fire Department's paramedic candidates that have been coming in and doing their clinicals and assisting our teams as well, taking care of both COVID and non-COVID patients.
So it's really all hands on deck. And
all hands on deck. GMH has done everything that it has been able to do since the onset in March 2020. We have taken areas that are not suited for inpatient care and made them suitable for inpatient care. We have served this island. We continue to serve this island. We are exhausted. We do everything we can. We stretch every way we can. COVID has taught us that we have absolutely no limits. So we keep pushing for everybody in this community.
That's all we have time for tonight. Thanks for joining us on Pacific Matters.